are from that side. Okay. Good evening, one and all. First of all, my apologies for there is some technical problem. I do not know today only why this has happened. And at the outset, let me thank the CNRS Society, the association, who has taken initiative to organize this research methodology course. And my sincere thanks to all of you for patiently waiting in spite of this some technical problem. So with the permission of the chairperson, let me start the session and we will go ahead with it. I would like to share my PPT. Yeah, is the PPT visible to you? I'm not able to hear the response from that side. Yes, I hope it is visible. If anything, Dr. Muthuving Tachalam can give. Yes. Yeah, thank you very much. So, yeah, this is a different type of communication. I think today we have to have, because this is one-way communication for me in this side. Once again, I welcome all the participants, and I'm very happy to see a good number of participants on this platform. Today's objective is that at the end of the session, the participants will be able to understand the various experimental designs and apply the same for nursing research studies. The outline of today's session goes like this. So we will first see about what is research approach and research design. It's already been discussed yesterday. And also the terminologies, like sometimes the terminologies will be confusing us from the social scientific research and the medical literature. The general issues, what we need to know about the experimental design and some of the true quasi and pre-experimental design, and then we will conclude the session. So to begin with the introduction, I would like to ask you just one question. I'm sure you all are, always planning your travel, and also you always involved in cooking. So which means that probably you use the plans and also the recipes. So these plans and recipes that will provide you the guideline, and that will help you to have a great travel outcome during your visit to various places that you want to see, or you cook, or you want to have a delicious meal. All how to put various ingredients to enhance the flavor in the right proportion, and that's what is the research design is. So I'm sure you have studied yesterday the introduction to research design and also the non-experimental research designs. So just to review what you have learned yesterday, it is the plan for obtaining the answer to the research question. So we know that there are many experimental and non-experimental research designs are available. So it is to the researcher how appropriately, or the specific design that has to be selected, that is to be, and the to identify these strategies so that to minimize the bias. So according to Pollitt and Beck, they say research design is the architectural backbone for the study. So that means it is like the foundation blocks. It is the one which shows you the way what it has to be. It gives strength to your study. And according to Kothari, the arrangement of conditions for the collection and analysis of data in a manner that aims to combine relevance to the research purpose with economy in procedure. So this is what Kothari says what nursing research design is. So with this basic introduction, let's proceed to the difference between what is research approach and research design, which you have already studied yesterday. So let me just give you a basic understanding. Now we are seeing a picture of a house, and we are seeing a picture of an outline, that's a blueprint. And this is what is like approach and research design is. So research approach is in a way like how to deal with the way, how to get answer to the question that is posed to. And the research design is something like a blueprint. I think all of us can easily understand, if we have to build a house, we need to have a blueprint. We need to have a detailed outline, like, what to do, and, the sketches that we need to have. So this is something like a difference between what a research design is and what a research approach is. Now, let me just pose you some of the questions, and I'm sure you'll be able to definitely give your response based on the yesterday's session, what you have undergone. So look at the first sentence, that what you're seeing on the screen. What makes people happy in the hospital situation? I'm not able to hear you, but still I think you can contribute, and Dr. Muttu will definitely assist. So what makes people happy in the hospital situation? So what do you think that the approach or the research design has to be in this? Maybe I request some of you to unmute your microphone and respond to it.
Ma'am, can you hear us? Audience are muted, ma'am. They are not able, the audience will not be able to unmute themselves, but they can put their comments chat. I think I request all the participants, if you have any comments, you can type it in the chat box. Madam will be able to see that.
I'm not able to get any response. Maybe like, what I expected, there's something wrong that's going on. So here, this question will tell us, like, what are we going to do? So whom are we going to ask this question? Whom are we going to study? This will give us an idea what a research approach that we have to look into, and how our design has to be. Or it could be the second, the question, what is the most effective way of teaching the students in professional courses? We are day to day, day in and day out, we are dealing with this, teaching the students, and still we need to have innovative methods. So how can we propose a new teaching method? So how do we go about it? Or suppose, let's think we want to observe 100 children over 5 years to observe their growth and development. So how do we go ahead with what type of research approach and what type of research design? Or it could be in the same class, there may be some children who are having the learning difficulties, and some may be without any learning difficulties. So how do we conduct a study among these children? So this is where we need to identify the appropriate research design that we need to select. So today we will be discussing on these research experimental designs, and we need to know that there are a variety of experimental designs, and some are very relatively simple, whereas there are some designs which are very complex. And researchers may combine the characteristics of more than one design, sometimes to make the to make it suitable to the needs of their study. And also, like, names of the designs may vary from one text to the another. So we may get confused sometime, what design is it? Because many a times, if we look at the nursing literature, we are studying from the social scientific researchers. And now that with the doctoral studies and the medical researches, there are a lot of medical terminologies which are, replace the social scientific studies. So let us just have look at it, because we are interested in establishing the evidence-based practice. And in order to have the scientific base, we need to understand the various terminologies that we are using in this experimental designs. So we use in nursing studies usually the experiment, the true experiment, or the experimental study, where the terminology that is being used in the medical research is randomized controlled trial, randomized clinical trial, or commonly it is called as RCT. Similarly, the quasi-experiment or quasi-experimental study, which is otherwise in medical research terms, it is a controlled trial or the controlled trial without randomization. The non-experimental studies or the correlational studies, it is looked as observational studies in medical research. The retrospective studies are On the other hand, these are the case control studies. The prospective non-experimental studies are the cohort studies. And usually in our nursing studies, we consider as a group, or it is a condition, or it is an experimental, or the control group, or it is a condition. And if you look at the medical research terms, they will say the group or the arm, the intervention arm or the control arm. And when we talk about the nursing research, we talk about the experimental group, and the medical terminology, which they say is the treatment or the intervention group. So it's very essential for us to know and get familiar with the terminologies. So in order to build the evidence-based nursing database. Now, what are the experimental designs? The common experimental designs we can classify into true experimental, or sometimes it is also called as basic experimental, and the other one is quasi-experimental and pre-experimental. The pre-experimental these days are also categorized under the observational studies. The true experimental designs, there are like pre-test, post-test, control group design, the post-test control group, that is post-test only control group design, Solomon 4 group design, randomized block design, factorial designs, the crossover designs, and the matching sample design. Whereas in quasi-experimental study, we have non-randomized control group design, the time series design, and the pre-experimental one, we have one short case study method and also one group pre-test, post-test, which is very commonly used, but it is, very weak design. Okay. And most of the time in nursing studies, we use that. So experimental designs that has been used, or it has been developed for a variety of studies, for usually for examining the causality. Now let's look at some of the general issues, that is, what is causality in experimental study? Because this is the mostly very debatable issue, and we need to understand the general concept of the cause. Like for example, let's say like lack of sleep that will lead to fatigue. We all understand that. Or for example, let's say high calorie intake that will lead to weight gain, but not necessarily that it's only the high calorie intake that will lead to weight gain. There could be many other causes which are leading to, or which are which are causing the weight gain. The simple example always which we talk about is that smoking is a cause of lung cancer. So what happens here? We know that smoking is a cause which, gives the effect of lung cancer. But if we look at the evidence, that not that all smokers are having the lung cancer, nor that all the lung cancer patients have the history of smoking. So here one thing in causality that we need to understand, that the causes of health related phenomena, those are usually are not deterministic, but they are rather probabilistic. And that is the cause we can say here. That means the cause increases the probability that an effect will occur. So this is what the causality that we have to understand. And this is the basic thing that we have to know if we have to understand an experimental research design. So that is the concept of causality. And another important aspect that we have to understand is the counterfactual model. So the counterfactual model is that what would have happened to the same people who are exposed to a causal factor. That means we need to understand that what is exactly an effect of the intervention. Okay, so that means the counterfactual is that what would have happened to the same people when they are exposed to a causal factor, or if they were not exposed to a causal factor. That means it is an effect that what we are studying, what would have happened. Now here, there are certain criteria for the causality that which are developed by Laserfield 1955 and which are quoted by John Stuart Mill in most of the books. So let's understand this simple basic things, and I think if we understand this, the whole design's understanding will be very easy. So one criteria is that temporal. Temporal means a cause must precede an effect. That means if you want to test a hypothesis that smoking causes lung cancer, we need to show that cancer has occurred after smoking. So that is temporal. That means there is smoking, a person is smoking and that person has developed the lung cancer. So cause must precede an effect in time. The second criteria is that the relationship. So there must be an empirical relationship between the presumed cause and the presumed effect. So what do I mean here? That it means there must be an association between smoking and cancer. That means it should show that the higher percentage of smokers will be having cancer than the non-smokers. So that is what is the relationship the causality should show. And next is no confounders. That is, no confounders means the relationship can't be explained as being caused by a third variable. Let's say, for example, we are finding this cancer among the smokers. Suppose it happens that these smokers are living in an urban environment, and there would be then some factors. There may be possibility that a relationship between smoking and lung cancer that reflect there is an underlying cause, where that means there is a connection to the environment which is leading to lung cancer. So that cannot happen if we have to show the effect is only because of the cause or the treatment or the intervention that what we are giving. So these are the criteria for causality that we have to consider, that is temporal, the relationship, and no confounders. Now, as we move on further in true experimental design, we'll see what are the characteristics of the true experimental design. There are mainly three characteristics. That is, one is manipulation, other one is control, and other one is randomization. These are the three important characteristics of true experimental design. So now let's little bit understand what is manipulation. Now, manipulation is that it refers to conscious control of the independent variable by the researcher through treatment or intervention to observe its effect on the dependent variable. I'm sure all of us are very clear what is an independent variable and what is a dependent variable. So independent variable is usually the cause, and the dependent variable is what we observe is the effect. So let's say the medication that what we are giving is the independent variable and the pain level is the dependent variable. Now, what happens here is that in manipulation, the researcher does something, at least to some participants. That means there is some type of intervention to some people and or some participants, and there is no intervention for some other participants. For example, another example, it's as given in the PPT, you can see, does a telephone therapy intervention. So this is an intervention. In bracket, I have put it I, and for patients diagnosed with prostate cancer. So that's the population what we are studying, whether it will cause improvements in their decision-making skills. So here, what output or what observation or what effect that we are seeing in this population is their decision-making skills. So which means that the telephone therapy intervention, the researcher may give to some people and researcher may withhold this intervention from some other people. That means the researcher is manipulating the intervention here. So this is what is the manipulation. That is, researcher does at least something to some individual. I hope I'm clear and I'm audible clearly. Okay. So what happens here? To have this intervention, there should be a proper intervention which is related to the problem or the area of study that what we are doing. And also this intervention should be of sufficient intensity and also the duration. And that is why exactly we need to define what intervention is in experimental studies in our operational definition, saying that what is the intervention and like how it is something different than the usual methods of care, and who is going to administer it, what is the specific procedure for administering the intervention, and what is the dose or what is the intensity of the intervention, how long this intervention will be carried out, what is the frequency, or when will the intervention will begin, or whether the administrator has any special training while administering the intervention. So, or we can also, question under what condition this intervention has to be given. So these are some of the questions that we have to be very clear when we are having the intervention that we are manipulating between the participants. Now let's move on to the another characteristics, that is a control. So what does the control mean? Here control refers to group of participants whose performance is used to evaluate the performance of the treatment group on the same outcome. So for example, if we see the example, that is diet of the premature infants. So this is the population with the special nutrient. So here special nutrient is the intervention, and the duration of this intervention is we are giving for 2 weeks, and what we are observing the effect is that the weight gain. Now suppose we have given this intervention for 2 weeks and we observe the weight of the premature infants. So how do we know? It is because of the intervention that there is weight gain among these premature infants. So sometimes it is difficult to conclude because it is a process of, the development, or during the process of maturity, the premature infants may gain weight. So we cannot conclude that it is only because of the special treatment that we are giving, the baby has gained weight. And this is where without a control group, that means a group where who is not receiving any treatment, it will be impossible to separate the effect of the maturation from those who have received the treatment. So that is why we need to have a group of participants whose performance that we can use, and we can say that yes, there is a difference between this group and the intervention group and the control group. So that is what is a characteristic of the true experimental design. Now, what are the various possibilities of all this counterfactual that we can do? See, what happens in case of nursing studies? When we design any nursing intervention, it is not possible for us to completely withhold any nursing intervention. That becomes unethical for us. So usually the nursing studies will have an alternative intervention. Suppose we are using 2 methods of, caring for a patient, whether it is a position or 2 different types of feeding or 2 different type of, like administering any medication or whatever it is. We are having the alternate method of intervention. And sometimes we also use the standard method. That means it is a usual procedure that whatever that we are caring or we are using to care for the patient, we may compare with the standard method and we may use our other intervention what we have worked out. There could be sometimes placebo effect, or it is otherwise pseudo intervention, which will not have any therapeutic value. It will not affect in any way, because many a times, like patients sometimes may think, why you're not giving, specific planned care to the patients who are in the control group. So the pseudo intervention, which will not have any therapeutic value. Sometimes also it could be the different doses or intensities of the treatment that the experimental group that gets an intervention which that will be more rich than what you give to the other control group. And the waitlist control group is that once you have completed all, the observation, the full experimental assessment or the intervention is completed, then all the control group participants will be given the intervention. So that is wait list control group, that is counterfactual, that will be given. So next we move on to the next characteristic, that is randomization. So we have discussed about the manipulation, control, and now it is the randomization. So randomization is, it means essentially that every subject has an equal chance of being assigned to any group, and randomization remains the most trustworthy and acceptable method of equalizing the groups. So here randomization that can be done by many ways. For example, suppose we want to study the effectiveness of a contraceptive counseling program for multiparous women who have just given birth. How we can do this randomization? There are many ways that how we can randomize the participants to various groups. So common one is that flipping a coin. So all of us are very familiar with it, like the if you flip a coin, if the coin comes up with the head, then the woman will be assigned to the control group, or the other one maybe to the experimental group. Then matching. Sometimes in nursing studies, matching becomes very difficult because, for example, but this is a method which is used for randomization. I'm saying it's difficult because it is, for example, we want to have, we are having women who maybe with more than 40 years old and who are having 5 children. So when we do matching, we need to have exactly with the same 40-year-old and who are having, who is having 5 children already. So we need to have an exact matching. But this is one of the method of randomization. Draw of lots. So we can have all the participants' names or numbers or whatever it is, we can put in hat, and we can just, take the names, that is like lots, lottery method. And table of random numbers. I'm sure all of you are familiar with it, where there are, random numbers. We can close the eyes and we can just point at one number. And then we see, like, for example, let's say we have 15 participants. So we can move to the right or whatever it is left. So whichever number comes between that, that will be assigned to the whichever group that as we have decided. Then also cluster randomization. So cluster randomization that usually reduces the possibility of contamination. So usually randomly assigning the clusters of individual to different treatment group. So usually this happens in the hospital setting, especially for nursing studies. We want to have 2 groups. So we complete one assigning to one group, experimental group, then the next group we are assigning to control group, so that there is no contamination. Then we also have other methods like computer generated random numbers, the the website randomization.com. So this is only to how we can do the randomization. Now let's, this is only the symbolic representation of the random numbers. I'm sure you are aware of it, okay? So let's move on to the basic experimental designs or the true experimental design. So first one is post-test only design. The otherwise, in some books, you may also find after only design. So it is composed of 2 randomly assigned group. One is the experimental group and the other one is the control group. So this is done after the random assignment of the participants to both the groups. So both groups are not tested before the introduction of the intervention, because it is, the name itself suggests it is post-test only. So while treatment is implemented on the experimental group only, but the observation after the intervention, that is done on the both the groups. So when we can use this, where there is no possibility to do the pre-test during the before the intervention, this type of design will be more suitable. For example, gentle massage on the pain levels of the elderly nursing home residents. So we can have 2 groups, we can assign them to control group, experimental group. As you can see in this figure, we have 2 groups, experimental group and the control group. The experimental group gets a treatment, whereas control group gets no treatment. Okay, and we have only the post-test in both the groups. So this design is helpful where it is not possible for us to take the pre-test of the subjects. Okay, for example, another example, if we want to do a a study on educational intervention related to contraception among the people. So here we may not be able to take the pre-test, so we can give the intervention to experimental group and we do the post-test and compare them. We move on to the next design, that is before after design, or in generally the nursing books we say it as pre-test post-test design. Pre-test post-test control group design also it is given in the book. So in this design the subjects are again randomly assigned to either the experimental group or the control group, and the effect of the dependent variable on both the group is seen before the treatment, that we have a pre-test. Then we carry out the treatment or the intervention to the experimental group. Then after that, the effect of the treatment or the intervention that is observed on the dependent variable, and here the post-test that is assessed on both the groups. Here, the random assignment of the subjects to the experimental group as well as the control group. We are doing the pre-test here, which was not there in post-test only design. Then the intervention or the treatment is given to the experimental group and the post-test is carried out in both the groups, and then that will be compared. So which will tell us whether the difference that is occurring in the groups, whether it is because of the intervention or no, because of the control. So that means here we have manipulated the intervention. We are having a control group with the similar characteristics where we can compare. Okay. And also we have randomized the group. So this is a true experimental design where we can see all the characteristics. So next important true experimental design is the Solomon 4 group design. So this is the combination of the various designs. That is, there are 2 experimental group and there are 2 control group. So control group 1 and 2, there will be experimental group 1 and 2. So here the researcher has to randomly assign the subjects to the 4 groups, and out of the 4 groups, experimental group 1 and the control group 1 will receive the pre-test, and the experimental intervention that will be received only by the experimental group 1 and 2. Then all the groups will get the post-test, whereas the effect of this dependent variable that is observed and that is compared among the 4 groups, so that the effect on the effect of the independent variable is assessed on the dependent variable. That means here the 2 groups are having the pre-test, 2 groups are not having the pre-test, 2 groups are having the intervention, 2 groups are not having the intervention, but all 4 groups are having the post-test. So the Solomon 4 group design, the experimental group 2 is observed at one occasion, and to estimate the amount of change in the experimental and the control group 2, the average test scores of the experimental and control group 1 are used as a baseline. The difference here is that there is a pre-test in one and there is no pre-test in the other. So the Solomon 4 group design is the most prestigious experimental research design, but it minimizes the threat to internal and external validity. But it is very rarely used in this in our nursing studies, and maybe in my experience I have seen only one study where this Solomon 4 group design that has been used. So the test is effectively presents the reactive effects of the pre-test. So because we have 4 groups, so that reactive effect that is taken care. So there's any difference between the experimental group and the control group that can more confidently be attributed to the experimental treatment. So we cannot say that it is because of the pre-test or because of the intervention. So we have the combination of the design in this. The only disadvantage here is that it requires a larger sample and it has 4 groups for analysis, and it is not that commonly used in healthcare researcher. So if we look at this diagram, we have 2 experimental group and we have 2 control groups. Experimental group 1 and control group 1, they receive the pre-test, and experimental group 1 and experimental group 2, both experimental group only receive the treatment. Here experimental group 2 and control group 2 do not have the pre-test, and control group, both the groups do not have the intervention. But the effect on the dependent variable is observed in all the 4 groups. That post-test is carried among the 4 groups for comparison. So this is very complex design, and it involves, if you look at alone the experimental group 2, it is just the only post-test design. If we look at the experimental group 1, it is a pre-test, post-test design, experimental group 1 and control group 1. If we look at this, it shows that it is the pre-test, post-test, control group design. So that is why it is the combination of the various design. Next, we move on to the factorial design. Its factorial design is a very complex and the multivariate experimental design. Here, 2 or more independent variables are simultaneously observed and their effect on the dependent variables. So it could be the characteristics or the treatment or the events or whatever it is that the researcher wants to test the efficacy of 2 different medication, let's say. So the design will facilitate in testing these several hypotheses where there is separate intervention, or there is no intervention, or there is interaction of intervention. So that is what can be studied in this factorial design. Usually the factorial design will have 2 into 2 or 2 into 3 factorial. For example, let's say 2 into 2 factorial design, that will have 4 cells, and each cell must have the equal number of participants. If we look at this figure, there the B and C, they have separate intervention. Like if we see C, the cell C, if we see, they have only the distraction, and if we see B, they have only the relaxation. Whereas if you look at the D, they have no intervention. That is, they don't have either, like no distraction, there is no relaxation. So that group of participant will serve as a control group. Whereas if we see the cell A, there is a relaxation as well as there is distraction also. So that is the interaction between the 2 independent variable. So here we can see that is the 2 levels, and that is 2 independent variable that we are studying the factor. This is a 2 into 2 factorial design. We can also have 2 into 3, 2 into 4. The levels can be varied accordingly. So here, this is another example. Like if we have to administer 2 drugs, that is, let's say it is, one is alpha, one is beta, and the other side, you see it is how many, 4th hourly, the frequency of administering the drug, 6th hourly or 8th hourly. So we study here the combination of it, 4th hourly, the drug alpha, 4th hourly drug beta. So it can be like this in various cells, but each cell must have the equal number of participants. Next, we move on to randomized block design. The randomized block design is used when the researcher desires to bring homogeneity among the selected groups. And this is a simple method to reduce the variability among the treatment groups by more homogeneous combination of subjects through the randomized block design. So this is somewhat similar to factorial design, whereas there is blocking of one variable. For example, if the researcher wants to test the efficacy of 3 different medications, so researcher can have 3 different categories of participants where he wants to administer the drug. It can be people with hypertension, or he can also have people who are under the treatment, and also those who are with some other, maybe some other comorbidity with the hypertension. Okay, let's see in the diagram. So here the blocks are, one is patient with hypertension, diabetic patient with hypertension, patient with heart disease and hypertension. So we can see the combination and the blocks that which is made, that is a randomized block. So design looks like that of a factorial design in structure, but out of 2 factor, 1 factor is not experimentally manipulated in randomized block design. Next, we move on to the crossover design. In crossover design, the study subjects are exposed to more than one treatment. So it is also known as the repeat measure design. So it's more efficient in establishing the highest possible similarity among the subjects exposed to different conditions, where the groups are compared obviously have an equal distribution of characteristics. So sometimes this design is not effective because the participants may have the influence of the treatment what they have carried, they have in the previous setting. So there has to be sometimes washout sessions. So for example, let's say we have two groups, that is a group 1 and group 2. The group 1 will get treatment 1 and group 2 will get treatment 2. So when we do the crossover, the group 1 will get treatment 2 and the group 2 will get treatment 1. So if you look at the diagram which is given below, also treatment 1 and treatment 2, group A will cross over and the group A will receive the treatment 2. So this is appropriate only if there is no expectation of carryover effect from one period to the other, because sometimes the participants may remember the treatment or the intervention, what they have undergone. So that may influence when the treatment or the intervention, the crossover is done. So that is a drawback of this design. So there has to be a period of washout period. So this is just similar to that. The first treatment A, then they will go to treatment B. The treatment B will be crossover to treatment A. So what are the advantages of this true experimental design? So true experimental designs are most powerful designs where we can study the cause and effect relationship between the independent and the dependent variable. And these studies, true experimental studies, are conducted under the controlled environment. So that will give you a greater, purity of observation, because it is under controlled observation, and its conditions that are not found in natural setting can be created in experimental setting. But this cannot go on for a long period, which cannot occur. That means the artificial conditions cannot be existing for a longer duration of period. And the experiment is carried out in an experimental setting. So the problems of real life situations or the personal problems of the researcher, those are eliminated in this experimental design. So what are the disadvantages of these experimental design? That is, most often the results of the experimental design cannot be replicated in studies conducted on humans due to ethical problems, because due to ethical problem, and human behavior itself is complex, so there may not be the same reaction. So many of the human variables neither have valid measurable criteria nor the instruments to measure them. And also the experimental studies conducted in natural settings like hospital or community, it's not possible to impose control over the extraneous variables. We cannot have control on everything, especially in nursing studies. We will not be able to have control on something where a patient will be getting medicine or patient will be getting any other treatment. We may not be able to have such control on this type of designs in the hospital setting. And experiments are often more impractical when the effect of the independent variable may require lengthy period of time before it can emerge as a response on the criterion measure. So these are the disadvantages of the true experimental design. So it's also very difficult to obtain permission from the participants sometimes, because the participants will be afraid, like what will happen if I participate in this study. So they may say like, oh, something they are going to do for me. And because of the size of the sample that is kept small usually in intervention studies involving humans, and the representative findings of such study is also questionable. So this theoretically, the experimental designs that can yield a greater insight, practically many times it is not possible on human studies, because the parameters also are very complex. So usually the Hawthorne effect, that is when the individual know that they are being included in the study, they automatically the effect or their characteristics or the behavior that that will affect the effect of the variable of interest. So that is the Hawthorne effect that is usually observed in this true experimental studies. So this is just for 1 minute distraction. I think long time you have been hearing. Just observe this picture. I found it somewhere. There's something what is hidden in this picture. Can you identify? I'm not able to hear even if you say that. Maybe we will continue and okay. So there is a person who is sitting here in this tray under the tree. If you can see this, okay, it's a very nice picture where I got, where suddenly if we see, it is just looking like a tree, isn't it? Okay, so okay, let's continue now. Okay. Next, we move on to quasi-experimental designs. The quasi-experimental design is that in which the researcher initiates an experimental treatment, but some characteristics of true experimental design is lacking. As you remember, in true experimental design, there has to be manipulation, there has to be control, and there has to be randomization. Whereas in quasi-experimental design, there's something is lacking, which is exactly is that of the true experimental design. So it involves the intervention, but there may not be randomization. The control will be there sometimes. Okay, randomization may not be possible, so it will be quasi-experimental design. It facilitates the search for knowledge and examination of causality in situations in which complete control is not possible. So we have to suppose if we ask, is there an intervention? So if you say no, then it becomes a non-experimental research. If there is intervention, then whether the assignment of the participant is done randomly to the control group and the experimental group. If we do random assignment, then it becomes a true experimental research. If the randomization is not there, then we can ask a question, are there any efforts to compensate for lack of random assignment? Suppose like there is a better control, so it becomes a quasi-experimental study, and if we do not compensate the lack of random assignment, then it will become a pre-experimental research. So in quasi-experimental research designs, we have non-equivalent control group design and also interrupted time series design. So non-equivalent control group pre-test post-test design. This is identical to the pre-test post-test group design, except there is no random assignment of the study participants to the experimental and the control group. Otherwise, like there is a control group, there is a experimental group, the experimental group receives the intervention and the observation is done, that is post-test is carried out in both experimental group and the control group. So it involves 2 or more groups of this participants and who are observed before and after the implementation of the intervention. Let's say, for example, we study to identify the effect of introducing a new hospital-wide model of care that involved having a patient care facilitator to be the primary point person for all the participants during the stay. So maybe like we are taking, sometimes we may take 2 settings also, but we are not doing the randomization. So here main outcome here is that patient satisfaction, where we are having the patient care facilitator and we are not randomizing the participants, but we are giving intervention to one group and no intervention to another group. One group post-test only design. So in this study, that is inability to obtain the meaningful control group, however, does not eliminate the possibility of conducting the research with integrity. So here we are having the intervention, but there is no control group. And so there is, of course, there is no randomization and we are doing the post-test. For example, we can assess the outcome of antenatal education on pregnancy and labor, or for example, children's attitude towards drug, which can be studied soon after administering drug to the child, which is where there is no pre-test also. Next is non-equivalent control group post-test only design. Here, exactly like the previous design, how we have seen, where a dependent variable is measured following the treatment in one group and a non-equivalent control group, it does not receive the treatment. So there is no pretest here. The experimental group receives the treatment and the control group has no treatment, and both the groups are given the post-test. For example, if we have to introduce the computer education to improve the staff morale. Okay. Next, non-equivalent control group post test. Just one example, another example I've just added. Suppose if we introduce one QM model in one hospital and we study its impact on job satisfaction of nurses. So we can use job satisfaction of nurses in the similar another hospital to compare the job satisfaction in one hospital. So if two groups are similar on pre-test, we could have the relatively confident that the difference in the post-test is because of the intervention that is caused. But in quasi-experimental group, the term comparison group is used in lieu of the control group, because we are not having the exact control, because there is no randomization here. So we will be able to compare with the other group. Maybe the setting is different. We can compare with one group with the other group. The next is a time series design. And there are also various multiple methods of doing this time series design. There can be interrupted time series design. So in this time series design, the dependent variable is interrupted, that is usually near the middle, or the manipulation of the independent variable that is being done. So there are multiple observations that is made here. O1, O2, O3, O4, O5 these are the multiple pre-test. In this type of design it is done, and once intervention is given, and then again we continue to have the observations again 4 times. For example, effectiveness of selected nutritional interventions on growth and development pattern of children attending the under 5 clinic. We can assess the children maybe for 1 year, then we give intervention once, then we can assess the children's growth and development for another 1 year. So this time series design can be carried out in multiple ways. Like it can be, for example, it is time series design with a non-equivalent control group design. Here, if we look at this design, we have 2 groups. One is the experimental group and the control group. The experimental group and control group both have observations, that is pre-test multiple times it is done. Experimental group is exposed to intervention, and both the groups are exposed to post-test multiple times. Then the time series design with multiple institution of treatment. So unlike the previous one, here the intervention is given more than once. So here 2 observations are done, then once treatment is given, again observation is done, again the treatment is given again. So this can be repeated. This time series design can be done in multiple ways. Again, further, here, this is intensified treatment. For example, 2 observations where we do, there is intervention, there is observation, then again with intensified treatment, 1 additional intervention along with the planned intervention, again the observation, again +2 the intervention. So this is the intervention is intensified with the usual what is given in the first time. Then sometimes we can withdraw the intervention. We can again, after withdrawing the intervention, we can reinstitute the treatment. So multiple ways this time series design can be carried out, so that the exact effect of the intervention that can be studied. So there can be control group, and with that can be, the effect can be compared. So the strengths of the quasi-experimental study, it is very practical design, and it is difficult to conduct. When it is difficult to conduct the true experimental designs in nursing research, so that is the place where we do the quasi-experimental designs. Many a times it is not possible for us to have a true control group, or sometimes it is not possible to have randomization, and this introduces some research control when full experimental rigor is not possible, and it takes the weakness into account in interpreting the results. So that is what is a limitation. As this becomes the limitation, also the several rival hypotheses competing the intervention as the explanation for the results, And the conclusion depend in part on the human judgment rather than the more objective criteria, because cause and effect inferences are maybe less convincing here, because we do not have the control and we do not have the randomization here. Okay, and next, coming to the pre-experimental designs. The pre-experimental designs are not an authentic experimental designs, but still this is very commonly used in nursing studies. And these designs does not control many extraneous factors, and also they are subject to a lot of threats to validity, and typically that is conducted for exploratory purposes, and it is financially and it is very feasible to conduct, and it is very convenient, especially for nursing students. They usually go for this one group pre-test post-test design. So the type of pre-experimental design, one shot case study method where a single group is exposed to an experiment and observed after the treatment. So here there are no comparisons are made, and there is no control over the internal threats such as history or maturation or selection bias, because there is only single group. Then other commonly used one is pre-test post-test group, pre-test post-test design, where here there is no control group, where pre-test is done on the participants and the intervention is given, and then the post-test is carried out among the participant. For example, we want to assess the effectiveness of the pelvic muscle, pelvic floor muscle exercises in control of incontinence of urine. So we can identify the participants, we give the pre-test to them, then we give the intervention, that is if pelvic floor muscle exercises, then we assess, like, in the post-test, how much is the control of incontinence, okay, of urine. So the advantages of pre-experimental design, it's very convenient and more suitable and very simple, especially for students. And disadvantage, it is a very weak design. The investigator has very little control, and there are higher threats to internal validity, and also because of the selection bias. Now, having seen these two experimental designs, the quasi-experimental designs and the pre-experimental design, let's see what is the rigor and validity of the experimental design. Now, we all know that the instruments, whatever we use, that for data collection, the instruments need to be valid and that has to be reliable. So in measurement validity is the instruments are accurate. Instruments will give accurate measures of the study variable. So the internal validity that we talk about, that is the results of the study are accurate for the patients or these participants who are included in the study. Whereas when we talk about the external validity, we see to how far the findings that can be generalized to the same population to that of the participants who are included in the study. So the internal validity is the extent to which it is possible to make an inference that independent variable is truly causing or influencing the dependent variable, and that the relationship between the two is not spurious effect of an extraneous variable. That means that the intervention, whatever that is given in this study, the effect on the participants observed is only because of the intervention that is given to the participants. Okay, so there are certain threats to this internal validity. For example, the history. So what happens, the history is, for example, it happens besides the intervention experimental treatment, that whatever that we have given during the course of the study, that influences the dependent variable. So for example, we are educating the women on breast self-examination, and after that maybe they are seeing the news on TV or various media, and they get more information on that. And we see that after the intervention, the post test, when we are seeing, and truly their performance is much improved. So it's not just because that it is because of the intervention, it could also be because of the history, that the other confounding variables, what is extraneous variables, those are which are affecting the intervention or the dependent variable. The selection is another important aspect. The how we are identifying the participants, how we are randomized, including in the different groups. That is the selection bias. That is, we are subjects that we are allotting to experimental group and the control group. So suppose, for example, let's say like we want to educate some participants who want to quit smoking, and we want to identify the participants. So we say we 5 participants we have identified who really want to quit smoking, and they all come to one group, and the other 5 who are not so much interested to quit smoking, they will all come to control group. So it's obvious that those who are in the experimental group, they are very much motivated to quit smoking. So the selection bias is another thing which will affect the the internal validity. The maturation, as already we have discussed in the previous example where we discussed about the premature infants. So during the process of the growth or development, the changes that happens, that will also influence the outcome on the dependent variable. Especially if we take any study on children, that's quite common, that is a weight gain during the growth of the children. That is what is a maturation. Then testing, that is where we are using the pre-test. For example, when we give pre-test, that is given, and when the subjects have the knowledge of the baseline data what we have given to them, so that will definitely impact the observation or the outcome that what we are using. And then the instrumentation, like where there may be some changes which is involved between the pre-test and the post-test, so which will affect the outcome of the the outcome variable. And the mortality, that is referred to the attrition of the participants, which will also influence the outcome of the study. There are similarly, there are also certain threats which are affecting the external validity. The external validity means how far we can generalize the research findings to the other settings. So we know that the findings are of that participants who are included in the group, but how far we can generalize these findings to the participants similar to the participants who are included in the study. So in there are certain factors which are affecting the external validity also, as we have already studied about the Hawthorne effect, where when knowing that they are included in the study itself will that will affect their behavior. That is expectancy effect. Novelty effect, that is when something new that happens, they will that their behavior will affect. And the interaction of history and the treatment. History, as we have studied, when something happens during the process or the treatment, so that will also impact. It is not only our intervention. The experimenter effect, the person who is conducting the study, the measurement effect. So this is where sometimes the masking of the participants that will be done, that is a single blind study, or it is the masking of the investigator, also that the double blind study, it is done. So these are some of the threats to internal and the external validity. So where we need to have appropriate intervention and also appropriate control in our design to have the effect of the proper on the independent variable. So these issues in achieving the study validity is that we need to have homogeneity in controlling the extraneous variable. We need to control over the constancy of the conditions. That will strengthen our internal validity but limits the external validity. And when there is a conflict between the internal and the external validity, it is preferable to opt out for the stronger internal validity. So when compromising the replication or repetition in a new setting, that becomes really critical in case of the experimental design. So in conclusion, so research design is a blueprint for conducting a study which maximizes the control over the factors that could interfere with the validity of the findings. So it's very essential that the investigator will select the most appropriate design, which requires understanding of what is the causality, the multi-causality, or the probability of having the effect, and what are the bias that may be interfering in selection of the participants, and what is the control that we need to have, then how do we manipulate the intervention, and what is the rigor and validity of the intervention. So these are the important aspects that is to be considered while selecting any experimental design. So with this, I conclude the talk, and we can maybe probably have some discussion. So some of the references, I've just put some of the questions as exercise. I may not be able to hear from that side. Maybe Dr. Muthu can help in this. So please read this. Which design would be most appropriate to use in trying to determine if clients' low back pain changes after they were taught an exercise to help to correct the back alignment? So I've given the 4 options here. One group pre-test, post-test design, post-test only control group design, one short case study method, post-test, pre-test, post-test control group design. I request the participants to please read it, and maybe you can, maybe you can message it. I hope probably they have answered the, yeah, okay. So we move on to the next one. So this is an exercise where, as part of the Women's Health Initiative study, 16,608 postmenopausal women aged 50 to 79 years with an intact uterus were recruited by 40 US clinical centers in 1993 to 1998. And they received conjugated equine estrogen plus medroxyprogesterone acetate in a single tablet. That is around NWIS sample size was 8,506, and the placebo was received in 8,102. So the primary outcome was coronary heart disease, that is non-fatal myocardial infarction and CHT death, with invasive breast cancer as the primary adverse outcome. So what is the design of the study that you intend to use in this study?
Please type your answer in the chat box so that madam can visualize too.
I hope there are answers, Dr. Muthu. Maybe some of them can unmute and they can respond to you. It is. Hello.
Ma'am, I will give the feedback through over the phone. You can keep the phone speaker on.
Okay.
Whenever you talk,
fine.
you can mute the mic so that all can listen.
Yeah.
Manage like.
Yeah, okay.
Yes, ma'am.
I really don't know what went
I think
wrong.
this is working. This is working. What you're talking, we can hear you. And what I talk, you can hear, so that we can connect this way.
Yeah.
It's a
morning there was meeting. It was all right. I don't know what went wrong.
Maybe
suddenly.
some device issue, ma'am. Maybe speaker not working. And people are answering like it is a case control study. And people are answering that it is an experimental design, true experimental design.
Okay.
And someone has mentioned as a crossover design for the previous this question. What was the design of the study?
Okay.
Yeah,
maybe then let's see what is a frame one research objective of this study following SMART criteria.
Yeah. Can anyone mention a any one of the objective for this frame objective for the following the SMART criteria? Someone mentioned as a RCT.
Yeah,
Yeah.
that's I think most appropriate one.
Yes, yes. Most appropriately. Definitely, it's not a crossover. As
No,
someone
it's not a crossover.
crossover. Yes.
Yeah,
It is a true experimental design, of course, but
yes,
more appropriately RCT.
RCTS. Yes.
Can someone
Same one
put an
objective.
objective? Yeah, one
Yeah.
objective. We have a lot of time. So after that, we go into the question and answer session. So till then, we can, you can participate in this activity. I think many attending through mobile may have difficulty typing the objective since it is a lengthy,
Yeah.
answer. Yeah.
The one or two, if they can say, that's fine. It is
Yeah,
the
yeah,
criteria has to be followed.
one answer has come to identify the side effects of the estrogen therapy on post-menopausal women. To identify the side effects of the estrogen therapy on post-menopausal women.
The last T, time duration.
Yeah. No, time, it was not mentioned. Only the time duration is not mentioned. Can anyone try again using all the SMART criteria?
Any answer?
Yeah, no, I think people are typing.
Yeah, no problem. They can take time.
6 months, but you have to bring that 6 months into the statement. That's what Madam meant.
Yeah.
Someone mentioned the time
Time.
6 months, but you need to bring that 6 months into the objective. It's the objective to have all the component of SMART.
Someone mentioned that longitudinal cross-sectional. No, I don't think that's a longitudinal and cross-sectional design. The most appropriate is the true experimental. Okay, it is RCT can be carried out.
Yeah.
The SMART objective is one someone has already mentioned. Only thing is within what duration that can be. If it is added to that, it becomes the SMART criteria. To identify the side effects of the estrogen therapy on post-menopausal within after 6 months of administration of that drug. Yes, that's fine. I think that's a good effort.
Yes.
Someone has done it. Yeah, very good. So I just have one more question there. 1 minute. Okay. Okay, you have planned to conduct a study to compare the efficacy of clomiphene citrate and letrozole in polycystic ovarian syndrome, and decided your primary outcome measure is a pregnancy rate. What type of design that you will go on? What is the design that you can go for? Okay, RCT. Since it is the drug control, it is you may not go for what is that somebody has written? Yeah, crossover also, but I think this is also more suitable, this RCT that you can go for. Factorial design also you can try, but it's since it is the efficacy of the drug that you can, through experimental study that you can, pre-test, post-test control group design that you can go for, the RCT.
Someone mentioned post-test only design.
Post-test only design. Yeah, that also may be appropriate.
Yeah, of course, the
Yes.
method may be a post-test only because the outcome will be measured only after the implementation of the intervention.
Yeah. Yeah, correct. Yes. And to see the pregnancy rate after, yes, that can be done. You can even have multiple groups also.
Yeah.
Okay. Yeah, fine. So I'm moving to the next one, a simple question. What threat to internal or external validity this statement will suggest? That it's a good thing that I'm in this new diet study. I couldn't believe it when the researcher told me that I was 10 kg overweight. So what is the threat that this indicates? The history, testing, selection bias, or Hawthorne?
There is a mixed response, madam. Majority answered as Hawthorne effect, and
Yeah.
few have answered as selection bias, and one have to answered as a testing.
The answer is Hawthorne effect for this. Okay, so yeah. Which item distinguishes true experimental research from quasi-experimental research? Size of the sample, use of non-probability sample, random assignment of subjects to groups, introduction of an experimental treatment.
Yeah, majority came up with the option C, madam. Random assignment of subjects with groups.
Yeah, very good. Okay. So I think with that, I'm concluding the session, and we can move on to the discussion. So
Yes,
I
ma'am.
think
We'll
there
go
are,
on to the question and answer session. Ma'am, there are two options. Either I read the question or you can open the QA and you can read out the
yeah,
question.
I have opened it.
Mm.
Someone has asked, can we say manipulation or randomization are same in the experimental? No, this is two different. Manipulation is where the researcher will be, exposing the intervention to some participants and not and withholding the intervention from some participants. Whereas randomization is like you're allotting the or assigning the participants to the different groups, whether it is experimental group or the control group. You can have various methods there, like whether you want to have, concealed, or whether you want to have, the masking of the participants, the masking of the researcher, whatever it is. The randomization is different from the manipulation, whatever. These both terminologies mean different. Giving pseudo intervention is ethical. The question is it ethical, right? That's what the participant is asking. See, it is the pseudo intervention sometimes. I also do not have the if it like what happens is the pseudo intervention here, which is given, that is not having any therapeutic value here. And if it is part of the treatment, of course, yes, that can be given. And if especially in nursing studies, I don't think we are having any, this pseudo intervention will have any major effect on the participants.
Ma'am,
But
also
not giving the,
yeah. Actually, even though if you are giving pseudo intervention, it is with the consent of the participant.
yeah,
So I don't think it violates any ethics because it is and one aspect of ethics is not violated. On the other hand, if you say that why benefit to be avoided by giving pseudo intervention, that is a different question. But the participants are giving consent to participate, I think.
yeah, exactly. And in nursing studies, usually this pseudo intervention, it can be like maybe if it is medication, the multivitamin or any iron tablet or something that is given, or if it could be the sometimes the standard treatment that itself is given, and the tailored intervention that is not given to the participant. So it varies depending on the intervention that is planned. The placebo is the pseudo intervention. That is what that we were talking about now. That means like sometimes do not to have any intervention. So there can be a placebo, the pseudo intervention that what we are planning to the group.
Thank you,
See,
ma'am.
to say it is a true experimental, we have to have randomization. So consecutive sampling may not be possible in true experimental study. So the true experimental study must have randomization. So the consecutive sample may not suit the experimental study, true experimental study.
Yeah, a request to the participant, please avoid the question to explain it again if it was covered in the session, because I have provided you the YouTube link. You can always go back and see the session again. So please avoid the repeated to repeat the any of the content. But if any clarity is required on anything, you feel free to ask, please.
There's a question on assessing the perception towards any topic. Which kind of design? I think perception, you cannot do experimental study because the human factors are very complex. Maybe you need to go for non-experimental designs. Okay, and focused group study, which design? See, focused group study is a method of collecting the data, and it is not the design. So depending on the design, what you select, you need to see what type of method you will be using to do the, you are using for data collection. It's not that we first say like we do focus group discussion and then we identify the design. First, it is a design itself is a blueprint. So there we have to decide what we are doing, how we are doing, when we are doing, how we are going ahead with data collection. So maybe your question can be, reversed based on the type of the study that you will be doing. What are the ways to prevent bias in an experimental study based on experience? So to prevent bias, I think we need to have a bigger size of sample, and the masking, the blinding, usually it is called like the terminology blinding is less commonly used now, like we say masking of the participants, a single blind or double blind, that is a blinding of the participants or blinding of the investigator. Increasing the size of the sample, and the control on the other extraneous variable. Sometimes in nursing setting it is difficult. So these are some of the ways to prevent the the threats to validity. Someone is asking the certificate. You may please contact the organizers, and I think if you attend all the sessions, you will be eligible to get the certificate. Internal validity means like how what is the impact of the intervention, that is how far the intervention has caused the effect on the dependent variable to what extent we can say that the effect that has happened is because of the intervention. That's what is the internal validity. In case need to carry out a study related to placing primary medication orders and referrals to the patient, do I need to face any ethical issues in India? I'm not clear about this question. Primary medication order and referrals to the patient. So I think you need to take the patient consent, and maybe you can make your question a little more clear about matching method for randomization. Yes, the matching is one of the method that is used in randomization. In real setting, the matching becomes a little difficult to have exactly these similar characteristics in both control and the experimental group. Like, for example, you want to suppose you're selecting a participant, for example, a person with about 60 years old and having a CHT. In control group you're assigning, that means you're having the conscious effort to allot the participants to both the groups. So you need to have the similar aged and similar characteristics person or the participant to the control group also. So that is a conscious effort of allotting the participants to the intervention and the control group. So this is depending on the, you need to see inclusion and exclusion criteria, and then that can be done. So pre-test, post-test. See, pre-test, post-test, I do not know you're meaning the true experimental design or the pre-experimental design. Can we do pre-experimental study in PhD? See, as such, pre-experimental study is a very weak design, and these days, if you see, that is categorized as a observational study. There's you need to see what is this area that you are studying, and you can select appropriate research design for your topic. Okay, and just an awareness program, giving an awareness program and assessing the pre-test and post-test is not considered as a research study, because you don't have to do any research to identify whether after giving an awareness program whether their knowledge will increase. Of course, even just if you see some you read some newspaper or watch the TV, any awareness program, obviously your knowledge will be better than whatever you are previously. So you need not do a study for that. So that is why this pre-experimental study is not is considered as a weakest design. Up to what level draining of samples can be acceptable during the post-intervention? So usually we keep attrition rate 10%. We keep attrition rate. So then it depends on the type of the sample, and the type of the study. So usually when you calculate the sample size, we keep 10% of the sample we add, considering the aspect of attrition in the study. True experimental designs, there are various designs we use in nursing, that is pre-test, post-test, control group design, factorial designs, the Solomon 4-group design, post-test only design, and the crossover design. True, I think these are the answers, maybe what they have written. Yesterday one madam told one group pre-test, post-test include the
response to the queries.
Okay. Solomon 4, yeah. Can we do drug-based studies in nursing? See, there are drug-based study, you can be part of the study, but drug trials, I don't think we are allowed to do, because we are not practitioners, like medical practitioners. So drug-based studies, there are so many other things which are related to nursing that we can do, like subscription, administration, and all that, which are related to medication. Hawthorne effect is that where the participants, there will be change in the behavior when they come to know that they are part of the study. And I think these are the answers that they have given: random assignment, C, RCT. Which is the best experimental design to avoid sample bias? Yeah, it is a true experimental design, maybe RCT, randomized control trial, that may be the best one. And for nursing studies, sometimes it becomes little difficult, the RCT. Okay. Can we give treatment to only control group? No, we give treatment to the experimental group, and control group is there to observe the, the same parameters to assess whether the intervention has caused the true, the effect on the dependent variable. That is, we are assessing on the similar group. That is what is a control group. In conducting a STP study, pre-experimental method master level is good, madam. Now, as I already told you, see, the pre-experimental study is most often it is used in nursing, but if you actually see, it is a pre-experimental study is a weakest design. And STP studies are not acceptable these days in nursing. So we need to go for, even if it is a cross-sectional study or just a descriptive study, whatever it is, we need to go for other studies. There are many things which can be found out clinically also in clinical setting. So the STP, this PTP and all that, I think we need to do away with this kind of study. That is my personal feeling. So we don't have to go for such studies, pre-experimental design. In nursing, what intervention can we give as pseudo intervention? In nursing, sometimes like, see, the common one is, the multivitamin tablets or multivitamin injections, that is which is administered. Sometimes the different positions, it depends on the intervention, what you give, which has to be similar to the intervention. So, and in experimental studies, can intervention be provided individually? See, every participant has to get the intervention individually. And it depends on what type of intervention that you are giving. Yes. Then the randomized block design, block design may be like you're having different blocks, you're categorizing the that means you're having blocks of the participants in different category, and you're seeing the effect of one intervention on this different blocks, where unlike the factorial design where you're having different levels, and that interaction between the two, this where that you're not observing, where you're blocking one observation or one parameter, that where it is blocked, and different categories of the participants that you are exposed to the intervention. How can we check the face validity in our research? See, face validity in our research, I did not get. It is maybe you're meaning the tool validity.
Yes,
the
I
face validity, maybe you need to go
think
for
confused with
expert
the
opinion. Face
tool
validity.
I think it was relevant to the tool validation, madam. Someone asked about the criterion validity also.
I think related to our topic, I think we have proceed model based intervention. Maybe you're talking about your own individual study. I'm not oriented to that proceed model. Solomon 4 group, like you need to have 4 different groups, and like you're giving the intervention to 2 groups and you're not giving intervention to 2 groups. So it's somewhat like the combination of multiple designs, where 2 groups don't get the pretest, 2 group gets the pretest, 2 group get the intervention. 2 groups do not get the intervention, and 4 groups are observed for the effect on the dependent variable. And mixed method design, where you are including both qualitative and quantitative design, that was not related to the today's topic. So your question is, can we take the control group and experimental group from 2 different schools? See, when you take from 2 different schools in true experimental, it will not be a true, because you're not having the randomization here. And it can only be a comparison that you can do in 2 settings. So yeah, it is, it's not a true experimental. If you're doing that, it becomes a quasi-experimental study. Is it compulsory to get a training certificate? Maybe Dr. Muthu Venkatachalam will answer to that. And the rigor is like the strength, like how far the...
Just 1 second. The query was that before conducting experimental research, the researcher should get a training certificate to conduct that research. That's what I understand.
Yes. So that is, okay. I misunderstood that. Yeah, suppose the researcher wants to administer any treatment, which is, something specifically that intervention has to be administered. The researcher definitely has to go for a special training. And if it is nursing, yes, the person will know what the nursing, nursing interventions are. But if it is anything beyond that, where it is the researcher is not having the expertise, the researcher is supposed to undergo the training and need to have the expertise on it. So that's what maybe the person is asking. Okay. And that is where we have to have a very strong intervention, and we need to define operationally who is administering it. The person who is administering is whether he is having the expertise in administering the intervention, and how frequently, how long the duration, under what circumstances. So these all has to be spelled out. And there it is very essential that the person should have the expertise in administering the intervention. So I think these are the questions. These are in the chat box. So
Okay, ma'am.
over to you, Dr. Muthu.
Yeah, ma'am. Thank you very much, ma'am, for your extensive session, and you have comprehensively covered all the designs of experimental design.
Not able to hear you.
1 second, ma'am. Ma'am, can you just put my phone? Okay. Can you hear me now? Yeah.
Yeah, now I can hear.
Yeah. Thank you very much, ma'am, for taking this comprehensive session on experimental designs. And what is more interesting was the question and answer session, because we had participants from diversity. We have diverse participants from either MSc students, finally B.Sc students, and also faculties. So the some questions were very novice, and some questions were asking about their own study, clarification, all those things. But still, you are patient enough to take all the questions and answered all the questions for the benefit of all the participants. And on behalf of CNRS, I thank you very much, ma'am. Despite your busy schedule, you've taken up 2 hours time to be with us today, and all the participants were happy to hear from you. And also, I take this opportunity to thank Dr. Lata Venkatesan, President of CNRS, to make this event possible. And once again, thank you for your consent to be in this program, ma'am. And once again, thank you all the team members to make this possible.
Thanks to you too, and I really, regret there was a technical error, but you made it possible.
Still we could manage. And message to all the participants is that, again, you can go back to YouTube and watch the session once again, at your own pace, then you can understand better if you have any doubt. Thank you very much, madam, once again.
Okay, thank you. Thank you very much.